Awareness Day. Oh, yes, thank you, Tiffany. And that's part of my little introduction to let everyone know it's being recorded. So welcome everyone to International Repetitive Strain Injury Awareness Day. This session is brought to you from Winnipeg, Manitoba, Canada. Those that are international on us today. We here at the center do lots of different things every year for this event. And I hope that a lot of you did a little, had time to do a little review. Last year, we did this awareness session on the link between psychosocial risk factors and MSIs. And we had 4 speakers giving brief half-hour presentations, and it went very, very well. We learned a lot, even though we've known about the epidemiology about psychosocial risk factors back in the 1980s and 90s, and how it sort of somehow is linked to an outcome of more reports of MSIs. So this year, our team decided to do more of the next steps. So welcome everyone to that. My name is Andrew Dolhe, and I'm an ergonomist with the MFL Occupational Health Centre. Today, I'm actually coming to you from Orangeville, Ontario, but I would like to acknowledge the team that is part of this. Let's begin. Let's get to the next slide so I stay on top of my thoughts. They're obviously, with world events, everything's kind of scrambled, right? Being Ukrainian myself. All right, so next slide. All right. Let's begin with our land acknowledgement. I actually spent some time being in Ontario looking at different land acknowledgements from, we have a speaker from Quebec, Montreal, Hamilton. I'm originally from the Sudbury area, and of course our own, and I found it to be very, very interesting to see how different areas of the country are talking about the history and the land acknowledgement. So let's begin with our own though. I would have liked to talk for about half an hour on that, but let's just be brief with our own. So the Occupational Health Centre would like to first acknowledge that we are presenting this webinar on Treaty 1 territory, where the Occupational Health Centre is located. The traditional territory of the Anishinaabe, Cree, Oji Cree, Dakota, and Dene peoples, and the homeland of the Métis Nation. We respect the treaties that were made on these territories, and we acknowledge that we are all treaty people. At the Occupational Health Centre, we commit ourselves to a process of reconciliation with Indigenous communities. Now, we believe that the content of today's event especially aligns with a commitment to reconciliation. And also, it's for a lot of you, maybe, it's the first day of Lent, which reconciliation between ourselves and everyone else is of high priority as well. So we want to emphasize how important it is that everyone at work be treated fairly and with the utmost respect and dignity. Protecting the physical and psychological health of everyone in the workplace is a shared responsibility. This is an important theme that we'll be touching on throughout this presentation. So over the years, the Occupational Health Centre has partnered with Safework Manitoba, and we'd like to acknowledge not only the team that is part of this group, but also the gracious donation they made to make this happen. So thank you, Safework Manitoba. Along with that, the Occupational Health Centre staff, I'll mention them by name very quickly, that will be helping behind the scenes today and as these breakout rooms. Our second presentation has a great, fantastic breakout activity. So in no particular order, we have Tiffany and Lisa and Jeffrey and Karen from the Occupational Health Centre that's helping out today. And from Safework Manitoba, we have Gail and Jen and Mike and Jack and Tanya. I hope I didn't miss anybody, but that's a great big group. We work on this, technically the debrief plans next year, and we get this team going in November. So this is a great thing. I know next year we'll be together doing some hands-on activities, because for those that are kind of new to us, we really love doing hands-on group work when we do our ergonomic RSI day activities. All right. So next, as far as some Zoom information goes, I said already that we are being recorded. But these breakout sessions, they will not be recorded, all right? And you may have our pictures and video on the side. So if you ask a question, you might pop up. So your appearance might be recorded, along with chats. So if you put in a chat, your name will pop up. So if you want to change your name to something anonymous and ask a question that pops up on the screen, just be careful of that privacy. Let's see, what else do I want to say? That's about it. That's about it. So let's move on to the next little part. For those that don't know us that well, I am going to be very brief with this. The Occupational Health Centre is on 167 Sherbrooke in Winnipeg. We moved there a few years ago. However, we've been around for more than 35 years. We started off with medical services. We're occupational health physicians, which see workers with all kinds of work-related, or I think it's work-related, injuries, diseases, and such. All right, so, and we still have that service today. So you can call us up and say, I think my family doctor doesn't know what's going on. I think it might be work-related. Can your doctors really check me out? And they'll spend hours with you. There's a key there, putting the time and effort into the resources. Obviously, speaking of resources, we have a library of very great in-depth information. And of course, we have services that will do research for you on your behalf. And at the bottom right-hand corner, you'll see our new website. Love to go through every little bit of it, but there's great information. So from the ergonomics perspective, there's the small business case studies that were way back in 2004, and then current ergonomic projects. So there's tons of ergonomic resources out there that are unique that a lot of places aren't really doing. Plus, we have a community initiative of Train the Trainer. We've been doing that for 15, 16 years, right? And then ongoing Aboriginal projects, Winds of Change. So for anyone, go to our website. And of course, we're not going anywhere. So call us, email us, find out more information. Off we go with that. All right, so next, I need to introduce someone I've known for a while. Jamie Hall is the COO at Safework Manitoba, and he'll be doing the welcoming address. All right, so very quickly, Jamie joined Safework Manitoba as Chief Operating Officer in May of 2014. He believes that we are on the cusp of monumental improvements in safety performance in Manitoba and in society as a whole. He is thrilled to be a part of the community of safety leaders who are building momentum for this change. A former Manitoba Hydro executive, Jamie has also served on the board of directors of Safety Services Manitoba. Jamie is currently a sessional instructor in the University of Manitoba's ASPER MBA program, where he delivers a course on executive responsibility and ethics. Jamie is a professional engineer with a BSc in electrical engineering and MBA with a specialty in human resources. And before I move this on, I gotta say, Jamie, you have to change something in your bio. We are no longer on the cusp of monumental improvements. We are seeing monumental improvements. All right, so with that, I will stop sharing my screen. And Jamie, you can begin.
Thank you. Well, thank you, Andrew. It's great to be here. And as you were reading my bio, I was thinking the same thing, that we have seen some really noteworthy improvements. I'd like to start just by saying, I'll talk a little bit about that, but I'd like to start by saying good morning to you, Andrew, and to everyone else. And on behalf of Safework Manitoba, and you talked about some of my colleagues who are here today, we're thrilled to be part of today's event. I guess it's true that time flies when you're having fun, because we are now in our 5th year, it's hard to believe, of supporting the Occupational Health Centre's Repetitive Strain Injury Day. And I'm pleased that we're able to gather, as you said, at least virtually this year, to discuss how we can continue to help reduce workplace injuries. And it's great to see familiar names and some familiar faces. I just saw Sari pop up. Good to see you, Sari. Great to get to hear from you again. And as I see the count here, we're just broke 100 attendees today. I'm sure that's going to shoot up even more as soon as the bald guy from Safework gives his opening remarks and you get on to the real reason you're here. I just want to share a few perspectives. At Safework Manitoba, we work with safety partners to help reduce workplace injury and illness. And we are seeing positive results, as Andrew said. The Workers' Compensation Board tracks injuries and illnesses by type, and RSIs, repetitive strain injuries, is one type, and that falls under musculoskeletal injuries. And Andrew, you can tell I've been doing this for more than 5 years because I can actually say musculoskeletal injuries now without stumbling. But easier to refer to them as MSIs. And we've seen that they have had a decrease over the past number of years, and they've dropped down to representing 34% of all workplace injuries in Manitoba. And to give you some perspective, between 2017 and 2019, remember the before times, before the pandemic, we saw a 20% reduction over those 3 years of MSI injuries. And so we know that our efforts are working. And when I say the safety community in Manitoba, the efforts are working. But we still have a long ways to go. A third of our injuries in Manitoba are still MSI injuries. And so we need to continue our work to bring that number down even further. And last year, with our safety partners in Manitoba around the table, we launched the latest 5-year plan to address MSI injuries in Manitoba. Today, you'll see even further collaboration beyond our provincial borders and across Canada with safety experts who are tackling RSI injuries. Today's event is a great example of maximizing our resources, coordinating our efforts, and working to stay current on trends in MSI reduction. The financial costs of MSI injuries are significant, and they impact workers, employers, healthcare providers, and our overall economy. And it's easy to assign a dollar amount to an injury, and I don't mean to be dismissive of that fact, but there is a larger cost, and that's to an injured worker's health. Not only their physical pain, but also the mental health struggles that they may deal with as a result of an injury. And many people don't suffer or struggle alone. The ripple effect of an injury is felt by family, friends, and coworkers. And that's what we're here to learn more about today. The Occupational Health Centre's team has put together a great slate of speakers who will share their expertise on the next steps in addressing psychosocial factors of MSI risks. And in closing, I would like to thank each of you, wherever you are, for your dedication to creating safer workplaces. I also hope that we will see many of you together in person at next year's event. Imagine that in one room. These virtual events have allowed us to gather at a distance over the past 2 years, and they have been very helpful, but I do look forward to once again seeing and speaking with each of you in person as we continue on our journey to reduce injuries in Manitoba. Thank you and have a great day.
All right, thank you, Jamie. Thank you very, very much for that. Okay, so back to share screen. And next, make that happen. There we go.